everyone. Thanks for the opportunity as well. Today's session, we're gonna do an overview about these two solutions, focus on anatomical pathology or in pathology, which are the ExpertPath and the ImmunoQuery. So I'll start with a brief presentation, just a couple of slides, and then we'll just jump in both platforms to see it in detail, a little bit of the content and the structure of these platforms. At any time, if you have any questions, please interrupt me. I don't have any problems with that. Either via chat, you can write, and then if you can help me to monitor the chat, meanwhile, I'll do the presentation, or if you want to open up your microphone and just pick up and question, please do. Don't need to wait until the end if you think it's best to do the question right away, okay? So just to have an overview about the first of the solutions, which I think is, in my personal perspective, a little bit more focused on a teaching environment, which is the ExpertPath. An ExpertPath is designed initially as a decision support tool to help anatomical pathologists based heavily on the content from the diagnostic pathology series of books from Emersys. I think the ones in the field will recognize these books that have the white cover now. I think the latest editions have a white cover, and there are several titles, and most of the content or the foundation of this platform ExpertPath relies on those books and the same editors that publish that, but with the advantage and now very adapted to the current reality that we all live in, that provides a digital solution. So it's in a way to have all that library at the palm of your hand in your laptop or on your tablet with the access 24/7 and with some other advantages or other, let's say, benefits of having a digital environment platform. Okay. As I mentioned, the idea is to support pathologists. In this case, we might believe also, or we do believe that students of pathology as well, in reducing their time to search for referential images. So as you can see in this small screenshot, we have several images, and you can appreciate that these images come from different backgrounds. So we have histological imaging, we have gross anatomy, we have cytology, we have even genetic and genomic information. So all type of information in a single platform, in a single system that gives a complete overview of the pathology in terms of all their aspects included here. It also helps with differential diagnostic information. So we have some differential diagnostics tables mainly that will be, I think, pretty helpful, especially for students when they're learning between different pathologies within one specific area or body section, as well as other some tools related even to concepts of laboratory management, clinical chemistry, and so on, as I mentioned, in a single platform. So in a way, optimizing their available time for studying or diagnosing, and to have precise and fast information, because everything here is evidence-based. So it's much better than looking in any Google platform where we don't know exactly where the source is coming from, and we know that many students use it. So it has more than 4,000 topics about most frequent or most complex diagnoses, with plenty of images plus 50,000 plus high resolution, sorry about the typo, annotated images we're going to see in a second. We have diagnostic group summaries, which can be very helpful, overviews about systems or organs in tables. As I mentioned, histological information with references, genetic and genomic information, which more and more in pathology is very, very relevant, and even some protocols to sample management in laboratories, as I mentioned. Okay. Now, ImmunoQuery is a second platform, and they can work together complementary, but they can work as well alone, individualized, and is much more focused on the immunohistochemistry, which stands for the IHC. So the idea is to have an efficient use of immunohistochemistry testing. This is very important or very relevant, especially in a clinical environment. But I think it's also relevant that the students learn from scratch the important usage of immunohistochemistry as a technique or as a methodology to confirm diagnosis and how to make the best use of it, because we know also that it's an expensive and a laborious methodology, but with very good results if used properly. So it's a kind of a different platform because it provides the supportive information that will help the user, let's call it, select the best markers, the best antibodies in this case, to optimize their immunohistochemistry analysis and to get this confirmation about the diagnosis or the information that they want, with summarized evidence that's extracted from publications, worldwide publications in the medical scientific field, basically pretty much everything that is in the PubMed that we all know that is there. It's summarized in tables like this one that you can see here in this small image as well, and will help us to select the tests. So the data is extracted for over 1.6 million publications, growing every day, with more than 2,000 different or discrete diagnoses, more than 3,000 antibodies mentioned, again, growing each quarter when there are updates in these platforms, and summing up over 44 and 1,500 possible combinations of antibodies and diagnoses that we can use to confirm this disease or that one, okay? And then we also have a learn section where we have antibody and diagnosis review literature, which can be also quite beneficial, especially for students if they are searching for a specific antibody or learning about a specific diagnosis in terms of immunohistochemistry. Always focus on immunohistochemistry, okay? So I think we can go directly to the platforms for the sake of time. Again, if you have, please, any question, write down the chat, speak up, interrupt me. There is no problem at all, okay? So I'm gonna jump in the platform itself. Let me drag this here. So these platforms, similar to the StudyX that we saw, they are very easy to access. No main integration needed. Can be web-based or can be VIP. We just have our username and our password. We just sign in and we jump directly to the platform itself. Apologies because I'm, as many people, working from home and my internet connection is not as fast. So this is the overview for those that already saw the session about radiology StudyX. It's very, very similar. You can see, you can appreciate the similarities. But for those that didn't participate, I like also to give a very general overview of the home screen. We have a free text search bar or search term that we can use to search within the contents of the platform anything that we want. Can be either a specific diagnosis, can be a characteristic, can be a marker, can be anything at all. The platform will search not only on the text title, but also in the contents of each page. So we would look for any mention in the text and highlight it for us. And we're going to see this in a while. We also have the primary categories, which is where the content that is over 6,000, barely over 6,000 topics currently, is divided by mainly by criteria of body parts or body sections like cardiovascular, bone, or breast. But in this case, as we have different inputs from different methodologies or different fields related to the pathology, we have, for instance, cytopathology all summarized here. As I mentioned in the beginning, even information about clinical chemistry, or for instance, intraoperative consultations. We have some topics. Also, the molecular and genetic part, which is very relevant, is summarized here, but we also have a topic specific for familial cancer syndromes, which is very helpful, and sometimes even laboratory management and clinical laboratory informatics. So we don't have only the dermatopathology or the endoscopies or the cardio, but sometimes also another text. That's why we have more categories. For those also familiarized with the books, the Amir's books, this more or less follows the structure of the books. So we have 20 plus books, and we have here also some 20 plus categories. Main advantage of this solution, as it's digital and as mentioned to StudyX, this is updated quarterly, so 3-4 times per year, whereas the books takes sometimes 2-3 years to come out a new edition. And the editorial process is much faster in the digital format. On the right side, we have two tabs. One is the recently viewed, so how our history of search, as each user has their own access, they have also their history within the platform. It's very helpful if I'm a student and I'm going to a class and I have to stop the search I have, close my computer, I close the browser or the search that I was doing, I can retrieve it quite easily by date. So the last 15 more or less searches are summarized here, and also the updates. So every topic that has been updated recently is indicated here. We also have this summarized in the support button that we have here on the right side, the top right side part of the platform. We also have a review of the updates just to highlight the level of updateness and the currency of the information. And we have here the two functionalities, similar again to StudyX. Bookmarks, my favorite topics. So whenever I'm looking for something, I'm studying about a specific part, or I'm diagnosing in a specific part or doing a rotation in some specific field, I can bookmark all the pages that I find relevant, and then the comparison tool that we're going to see in a while. Okay. So I always mention when I'm presenting that ExpertPath, I think there is two ways of looking for the information. I try to emulate a little bit. So first of all, let's say that I'm a student. I'm starting to learn about breast pathologies, and I want to explore a little bit what the content of ExpertPath can provide me in terms of information. So I don't have a search term. I don't have a specific diagnosis in mind. I just want to overview and maybe get to some pathologies related to what I'm learning about. So I can just explore the section about breast, for instance. And here you can see the different types of contents, which are all diagnostic pages, the virtual pages, some related directly with diagnosis, but in some cases we have some overviews. So for instance, if I want to see just the normal histology or the normal configuration about breast samples, I can just go in normal breast. I'll have here a topic about histology of the normal breast. And here I can appreciate by clicking on it, the content of this topic. As mentioned before, the information here is summarized by experts. So in this case, they are assigned here is Dr. David Hicks and Dr. Susan Lester, which I think are very known in the breast pathology field worldwide. They have reviewed several literature, not only what we publish as Elsevier, but all the literature available, and have compiled this information to have very focused, very directed information that can be reviewed in seconds. Also very adaptable to the current study of current students. We know that they tend not to read for hours a textbook. They tend to look for the information with clicks and very fast. And I think it's very adapted to that because the information here, as you can see, can be reviewed in a few seconds or in a few minutes, depending on how much information I want to take. We have these easy navigation bars. So if I want to see just the gross anatomy of the breast or the information, I can just jump into this information, or I can go directly to the microscopic information about the anatomy, or for instance, more in-depth information about epithelial cells, or the stroma of the mammary part. And the right side, we have the images. The images can be enlarged, and they are digital, so they don't lose resolution in any size of screen. We have some kind of schemes or textbooks images like these ones, but more relevant, we have, in this case, histological images, all annotated, meaning that the experts that review these have selected and pointed out the main structures, the main information comprising these images to help the user to review that information, to have it very clear what we want to see here, with the great advantage that if we want to download these images outside of the platform to use, if I'm a student in a presentation for an assignment that my teacher has given to me, or if I'm a teacher and I want to use this for a lecture, I can download this to presentation in a PowerPoint slide very easily. I just do a click. You can see that this is downloading this image to a PowerPoint. I'll bring the PowerPoint to this screen. As you can see, this image has been downloaded to a editable PowerPoint slide, so I can shrink, I can move it. It comes with the explanation on top, but on the bottom, I'm sorry. But I can put my personal note for my class or for my assignment. And it comes with a watermark of ExpertPath, which means that for academic and teaching purposes, I can share this in my own presentation. I can pull in other images from the platform or from outside the platform, compose my presentation as best as possible, and make use of these images, not only inside, but outside of the platform, okay? Also very relevant. Everything, as I mentioned, is evidence-based. So there is selected references by the authors in case I want to go more in depth. These references are not full text because we are not limited to what we publish as Elsevier, but we can provide a link to PubMed in a way that's much easier to get to that information if I want to read more in-depth information. In this case, as you can see, it's a Springer article. So we could not provide this full text access, but via library resources, they can access this information, or if it's open access title. And here in ExpertPath, I think this is very, very helpful. We have these tables. Most or in many, let's say many of the topics here, we have these tables. In this case, we are reviewing normal histology of the breast. So we have anatomic structure and associated lesions. So already giving me some information about characteristics, presence, absence, and even in some cases, which type of markers, proteins, in this case, related to the immunohistochemistry, if I want to confirm something, which markers I could use for a protein expression profile, the function of these types of cells. So I think these tables are very helpful, especially for students to have in a very simple and fast format some typical structures, diagnosis information. We can see it in a way. Okay. If I like this information, I can bookmark it. As I mentioned, I can just click here on this button. And in any time where I'm using the platform, I can access my bookmarks here, which takes me, for instance, to review, as it could not be the coronavirus, the COVID-19. If I want to go directly to that topic because it's a favorite, it's a bookmark, I can just click it away. As you can see, we already have plenty of information about COVID, which shows that the platform is very, very, very updated. This has been composed already last year, and more we have more topic pages. So I'm just showing one in the topic of infectious disease, but I could show another topic that is related to the nephropathies that are caused by a COVID infection in patients. So a secondary effect, a comorbidity that COVID could cause. We already have a page specifically in the urology or the nephrology part of the platform, okay? But I can always bookmark if I want, as I have this here, to have this quick access, okay? Now I'll go back to the home screen and let's think something more advanced. So let's say that I'm already in the 6th year of my med school or in my specialization period, or I am a professor. I want to use this to create content for my classes, and I already have a search term in mind, so I can use this free text part and look specifically for what I want. I don't need to explore everything that the platform have in one section. And I have the advantage of looking for information in several sections. And for that, I will use a specific term, papilloma. As we might know, papilloma can have several presentations. So we have papillomas pretty much in many parts of the body, let's say. And for that specifically, I'm going to use papilloma as a search term just to highlight some of the functionalities and contents of the platform. Again, as in StudyX, we have this drop-down menu, meaning that in case I have some difficulty with the English, if papilloma have a double L or double P, I might be confused. I can just type in slowly. I'll have already some options. And again, to see the most search terms related to papillary lesions or papillomas, maybe it already gives me an idea of something more precise that I want to look for. But in this case, I'm going to look just for papilloma, generally speaking. Then I'm going to just press enter. So differently than exploring one specific section of the platform, here I'm going to see everything from the platform for ExpertPath related to papilloma, either in the text title or in the the diagnostic title, like a neuroepithelial papilloma or a Mullerian papilloma, but also I will have eventually some tumors that can be related to papillary lesions that we're going to be highlighted here as well. Or in some cases, and this is what I want to show, for instance, this very useful topic that's an overview of papillary lesions in the breast section. So this is papillary lesions in the breast, but that is readily available here. And if I click it, as I clicked before to see some overview, you can see that the search term is highlighted in the text. So I can look for a specific description or word, and I don't have to search for it in the text. The platform already highlights this. So if I look for a specific detail of information, description, marker, I can just be directed, my attention can be directly to that point where it's mentioned on the text, okay? In this case, it's an overview, so papilloma is described here several times, but as you can see, again, we have a very useful overview topic that for students, even for fifth, sixth year student can be quite helpful. We have here already the pathogenesis information, genetic information about molecular markers, mutations that may cause a papillary lesion, or it can be on the background of these lesions. We have clinical implications. So we have several informations, not only the images and not only images about histology like this one, but we could see immunohistochemistry with a molecular marker here, just highlighting the structures, the myoepithelial cells, for instance, in this case, the black dots here or the darker dots. But we would have several images, in this case, with different conditions related to papillary lesions, like a papillary carcinoma or just a papilloma, for instance, which is also highlighted here. So we have papillary carcinomas, intraductal papillomas, etc. And again, call the attention to these very useful tables. In this case, very helpful. Papillary lesions, about differential diagnosis table for papillary lesions in the breast, saying this is the normal types or the main types of papillary lesions found in the breast. This is the main characteristics that can help me differentiate between them. If I do a P63 staining, I'll have this type of expression in the markers already. Again, mentioning about the immunohistochemistry. If I do other markers like CK5 or 6, or if I find some structural components in the epithelial cells, I can see, well, myoepithelial cells in some cases, in the others, absence of those, etc. Expression about other markers like estrogen or progesterone, etc. Okay, so I think it's quite helpful. However, I'm gonna go back to the search, okay, that I did about papillomas. So I already mentioned that we can see papillomas in various regions, so genitourinary, gynecological, head and neck, so all the presentations of a papilloma. And this calls my attention to the two functionalities buttons that we have here. So first of all is the preview. As the platform is already providing me this preview, I can quickly overview the information, either text or image. So in a simple click, I can just jump into the images. I can expand the images, review it very fast to see what I was looking for, what my interest is in, a Mullerian papilloma, yes or no. I can just preview it and say, okay, it's not. Let me go to something else. It's a squamous papilloma. So I can just preview the squamous papilloma with their images and with that information. So we can use this preview, and this is available in any page at any time, also to quickly review that information in case we have this very complete series of search results that we have. But let's say I have too many search results and I want to focus. So again, I'm going to focus on breast. And I say, okay, no, I just want to see the papillomas in the breast area because this is what I'm studying, or this is my sample, or this is my interest. Okay, so I just click on this filter by category, select the category, which is the main categories that we see in the home screen, and I eliminate all the other types of papillomas, remaining just with the breast papillomas. But again, let's say I'm in a criteria of exclusion. I could overview the papillary lesions in the breast. The table could be very helpful, but still I have some doubts between two or three things. So I say, okay, could be a papilloma, what I'm studying or looking for, but could be also a papillary carcinoma, which is much more aggressive, or even could be some other things like an atypical ductal hyperplasia or some other results that I can see here. How can I compare them side by side? So we have this ability to do the comparison, which is the compare functionality. So we have this second button here, which is this this icon of my compare. I just click whatever I want to add for a comparison. So I could add a papilloma, I could add a capsular carcinoma, a papillary carcinoma, sorry. I could even mark an invasive papillary carcinoma, which can be some invasive metastatic cell that can be causing that disease or that condition. And I could even mark a ductal carcinoma in situ and compare these four. So I have this out, I want to compare. There's no limitations. I can add as many as I want, okay? I just add four just to highlight. Just click on this button on the the upper right side of the screen, and as I would be make an analogy, as I have 3 or 4 libraries of images, 3 or 4 summaries of information just side by side. So if I'm diagnosing and I have 2 screens, I can have my slide in one screen and this on the other to compare. If I'm studying and I want to use comparative images, I can just select the images that I have that I think are more comparison. So histological images, immunohistochemistry, for instance, I could select the same marker for these two, like the P63, to see the mesoepithelial cells present here, absent here, which could be a criteria of exclusion, why this could be a carcinoma or just a papilloma, and etc. So I can use these images as I want, pretty much. And I can just shift it very easily to the text, as the structure of these pages are similar, even with the top differential diagnosis. I could, as best as possible, compare the information also present here in terms of criteria, definitions, or histological findings, genetic markers, etc. So I have here DNA, mRNA, protein, histology, mammographies, ductographies, everything that is related and could help me to reach that conclusion or that diagnosis, okay? Then I can just dismiss what I don't want and finalize my comparison and get to the point that I want. In case I think it's a carcinoma, I just can jump in the content and then just review as we have reviewed before, okay? So for the sake of time and to have time to also talk about ImmunoQuery, I'll do a 30-second pause to see if there is any questions about ExpertPath, any doubts. If you want to ask it now, feel free to do so. If not, we can just go to ImmunoQuery and review ImmunoQuery in detail as well. So meanwhile, I'm opening ImmunoQuery. I leave some space for questions. Okay, feel free.
I also can see questions in the text, just in the chat. So please feel free to drop any questions in the chat, or if you have any questions about ExpertPath now, please unmute yourself and ask them.
Okay. Thanks, Dia. So if there is any questions, just for making most of the time, I will start speaking about ImmunoQuery, but in the end also we can review anything that you have doubts regarding ExpertPath or ImmunoQuery, okay? So let's talk a little bit about ImmunoQuery now. As I mentioned in the beginning of my presentation, this is a much more in-depth platform about one specific aspect of the pathology diagnosing process, which is the immunohistochemical or the immunohistochemistry analysis, okay? So I think we all know that this is a very helpful methodology or tool, let's call it, to confirm a diagnosis or to have an idea of which markers we could use to reach a diagnosis, okay? And I think the platform can provide us both takes of that question. So either I can say, okay, I have this doubt between these two diagnostics, which markers could I use in an eventual situation where I want to confirm if it's either option A or option B or option C even? Or in the other way around, if we think about the immunohistochemistry panels that are very common as an initial study to rule out some type of diagnosis or some type of disease, especially when we're talking about, for instance, carcinomas or cancers. We could also have the situation where we have a profile that doesn't fit our expectations or what we would expect in case of the clinical background of the patient. And we get puzzled to say, what else could I be or should I be considering that I'm not considering? So I think the platform can also give us some hints on how to proceed in case I reach a dead end regarding my immunohistochemistry panel. Okay. So let's think on the both situations. So for that, the main functionality here is the build panel, okay, which is by default what is showing in the platform when we enter it. And we have two options, diagnosis or antibodies. So we can either review from one side or the other. Let's start with the diagnosis. So if I have a question, I'm studying about gastrointestinal pathologies. I'm a student and I have this doubt if I get this confusion about, for instance, a gastrointestinal tumor or something else, how could I confirm if it's a gastrointestinal tumor or something else like a leiomyosarcoma, which could be a very reasonable doubt in the field, okay? So I can use the platform to help me with that information. So I can just type in the name of the diagnosis I want to look for, can be the full name or the acronym. So in terms of the soft tissue gastrointestinal stromal tumor, all that sentence, the acronym is GIST. We can just type GIST and we find it exactly like that. But we can find any kind of synonym that is shown here. So gastrointestinal tumor, gastrointestinal stromal tumor, colorectal tumor, anything could point us to the soft tissue gastrointestinal tumor according to the nomenclature of the WHO. So this follows the standard of the WHO, which is quite relevant. So we can just add it to the selected panel because we're going to build a panel of immunohistochemistry analysis we could make to confirm this or that. And I can compare, for instance, with the leiomyosarcoma. Again, I can just type in the platform you're already selecting and pointing out to the most similar search terms. And from all these options, even if I don't know if it's with a Y or with an I can just type in slowly, but I can find here the soft tissue leiomyosarcoma, okay? And I can just add this as well. Currently, the platform has a limitation of either 3 diagnoses that we can compare or 3 antibodies. Why there's this limitation? Because if we put too many diagnoses, we could have a panel of several antibodies, or if we put a panel of several antibodies, we could have several possible configurations of diagnosis that could fit that profile. So in terms of not adding complexity, but giving us more helpful information, we limit currently to 3 diagnoses or 3 antibodies, okay? Which doesn't mean that I can do several panels if I have several antibodies or if I have several doubts between conditions or diagnoses. In this case, I'm gonna just compare 2, and then in the antibodies, I'll use 3, okay? So whenever we have selected what we want to compare, so the question here could be, if I have a doubt between diagnosing or confirming a gastrointestinal tumor or a leiomyosarcoma, which tests of immunohistochemistry could be helpful for that? We just build a panel, okay? And then the platform will give us 2 types of information here, or 2 formats of information. First of all is the comprehensive panel. Second is the suggested panel. So the comprehensive panel first is a complete description based on evidence, based on publications available, peer-reviewed publications, that summarizes all the cases where researchers, doctors have used antibodies to confirm either a gastrointestinal tumor or a leiomyosarcoma, and will tell us which antibodies they use, how many cases there is in total, how many publications, of course, the information is extracted from, and what's the positivity, so in which cases it was positive or not positive, meaning negative, okay? So, and this is summarized in this table. So this table is telling me, for instance, that if I use CD117, which could be a very useful marker and very cited and very used worldwide, I can see that for this almost 9,000 cases coming from 81 publications, 93% of those were positive. In a way, we could assume that it's positive for gastrointestinal tumor in most of cases, okay? And differently, for leiomyosarcoma, just 2% of 700 cases, also cited within these 81 references, are positive, meaning that it's primarily negative. Meaning, ergo, that if I use this antibody, if I have a positive result, it's most likely a gastrointestinal tumor, and if it's negative, most likely a leiomyosarcoma. Okay, and that's what these arrows, the green, red, and gray arrows or differentiations, are telling me. So versus the condition 2 or versus the condition 1, it differentiates if I use this antibody because they have opposite results. So if I use CD117, it's positive, let's say, for GIST and negative for leiomyosarcoma. Whereas if I use, for instance, SIRT1, it's primarily positive for leiomyosarcoma and negative for gastrointestinal tumor. Very important that this is information extracted for publications, and doesn't mean that I have to use that or the other antibodies. Just give me options, okay? And then I have to use my clinical judgment and my knowledge and the clinical background of the patient eventually to select if I should use this antibody or not. If I want to review the references, I can just click here on Reps, and I have here a list by the most recent to the most older publications that are mentioning the use of the CD117 marker in either the GIST or the leiomyosarcoma. And it's check mark if that publication mentioned one, the other, or both of these conditions. So we have here some publications just talking about GIST. So they use for confirming GIST because we saw it was positive primarily, but we have some other conditions where they use just for ruling out probably leiomyosarcoma. And eventually we will have a publication or publications where they use for both conditions, which could be very helpful actually if I want to just go there. And as you can see, it's also mentioning another marker that's DOC1, which is also highlighted here just below CD117, okay? But more helpful, I have the suggested panel. So the suggested panel, the platform already pre-selects for me the best pair, because if you use just one antibody and it's positive for one condition and negative to the other, can be positive also for other conditions or negative to other conditions, apart from those two that I'm considering. So in this case, if I want to have a clear definition, if it's either A or B, I should use eventually this pair because we have typical positive, negative, negative, positive for one of the other condition, okay? On top of that, I can apply two filters. One is the sensitivity of the marker itself. So it's more sensible the marker, the molecule that is related to that condition, and goes from 1 to 3, meaning 3 is the most sensitive and 1 is the least sensitive. Or if I want a more strong background in terms of publication, so more evidence that supports that that indication that I should use that antibody, I can select if I want +1, meaning that just one publication is enough, like this case of smoothing. But I can say, no, I just at least 5 publications to be something that I believe it's quite helpful. I just click here and you're going to see that either in the comprehensive or suggested panel, I already shrink down the list, I filter, and then I have already showing me the CD117, which I could use it because there are several publications, 81. And I can use also Desmin, which have 100+ references telling me that is primarily positive for leiomyosarcoma and negative for GIST. So if I use this combination and I get positive for the CD117 and negative for Desmin, I'm pretty sure that this is a GIST. The opposite, I'm pretty sure it's a leiomyosarcoma, okay? And I could also play with the sensitivity. Quite relevant. If I want to let's say save or export this, I can either print it, clicking on the button print, and I'll have this list, okay, that I could save as a PDF and use for teaching and academic purposes, not for commercial, of course, but I can also save for analysis. So if I want to keep a background of panels that I could be interested in, same as the bookmarks in the ExpertPath, I can just save for analysis, okay, clicking here. And you're going to see that I use this example quite often, that I have here my selected panels, which takes in consideration the filters. So in this situation, I have the same analysis, but I have different filters and I have different antibodies. which could be relevant for my study, for my clinic, for anything. And I have several panels of other conditions saved by date that I can review anytime. And as this is updated each 3 to 4 months, sorry, as more evidence is added, more evidence will be added here when I view the panel again. I don't have to look for it or search it again. Okay. So I did in the case of the diagnosis. Now I'm going to do in the case of the antibody. So the question here, I believe, would be, if I'm doing a panel for normal analysis, a standard panel is a very used panel in case of immunohistochemistry to select some or to rule out some kind of condition or confirm one. And I have an expected result. So I'm going to use a breast cancer very frequent panel or screening panel that we use is with the marker HER2 for the mutation, the genetic mutation, and then the markers for estrogen and progesterone. I'm looking very fast for the antibodies, either by their names or the clone names. As you can see here, this is all the clones for PRP for all the kinds of manufacturers or biotech companies that produces these antibodies. But it's gonna be the same as the synonyms for the diagnosis. If I look for 636, it's gonna reach me the antibody for the progesterone receptor. Okay. And I'm gonna just add whatever I want. As I mentioned, there's thousands of antibodies here. We can find pretty much everything related to diagnosis. And in this case, I'm gonna use 3. So this is a very common screening panel that we do for breast cancer, for instance. And I would expect, for instance, in my case, or in my patient, or in my study, that will have just a positive for the HER2 marker, which would tell me or indicated that this is a carcinoma with the mutation on the HER2, probably a cancer familial syndrome from a patient that have this condition, this hereditary genetic disease, right, or condition. But let's say that in this situation, I got the progesterone marker positive, and I say, wow, what else could I be considering here? So maybe it's not a mutation and it's not a genetic disorder that's inherited. Maybe it's a metastatic invasive tumor in my patient or in my case. So what could meet that type of profile of immunohistochemistry? And the platform will give me just that. So it gives me the list of discrete diagnoses that have publications that matches that result. Meaning that if it's a field symbol, the green field symbol, it's positive. If it's empty, it's negative. So in this case, we have all the possible combinations. So every marker positive, just these 2 positives and this one negative, just this one positive and these 2 negatives, and etc. So all the possible combinations with all the possible discrete diagnoses that could meet that profile. Sometimes we can see that we have several options, which can be some troublesome. But in these situations, let's say that I expected this, and I expected that it would be this type of diagnosis because 99% of the carcinomas with the genetic mutation on HER2 are positive for this marker. But here we have progesterone also positive. And in this case, I could be considering maybe an invasive granulose cell tumor from the ovary that could be affecting my patient or my case, because this would meet at least in 1 or some cases, 9 cases, for instance, this positive for HER2 and positive for PRP, but negative for estrogen. If I want to review the references, again, I can click it and I'll have the publications also telling me if in this publication they use this marker, or that other marker. Sometimes we have less publications, sometimes we have more. For instance, in the breast carcinoma, when it's positive for the estrogen and progesterone, we have 89 references. And as you can see, this is a very common screening panel. They tend to use all these markers together. Okay, but I think the idea here behind is this, that it can help me consider something that I was not considering. Last but not least, if I go to the Learn section, I can just review information about a single diagnosis or a single antibody. In terms of diagnosis, if we go to GIST, it will give me a concrete list of all the antibodies ordinated or selected either by positivity or by alphabetic order. So I can just ordinate them. And I can see that the ones that are 100 positive in that many cases are these ones, 99, etc. And we have here a list of publications from the most recent ones to the less recent ones talking about immunohistochemistry in gastrointestinal tumor. Again, for a student, can be very helpful to have a review on that topic by reading those articles or using those articles as references. If I want to see in the case of antibody, and I want to see about the HER2 antibody, on the opposite side, I can see, well, first, all the clones and the companies that produces this type of marker. If I'm in an environment where I'm ordering these or I'm buying this type of reactive, I can just select the manufacturer. And I can also see all the diagnoses that were, all the cases where we use HER2 to reach a diagnosis, which diagnosis was that, and what is the positivity of this marker. So in adenocarcinoma, there was 8 cases was 100% positive with HER2, etc. And on the right side, we have again our overview about all the uses of HER2 as a molecular marker for immunohistochemistry, now not restricted to one diagnosis, but for all the types of diagnoses that could be reached using this antibody. Again, can be quite helpful if a student is doing an overview about this marker, which diagnosis would be covering these 400 plus articles, of course, from the most recent to the most old ones. Okay. I think for the sake of time, also to leave 5 or 10 minutes for questions. If there are any questions, I go back to the screen and open up for any kind of question that you might have or any kind of comment from the audience, also from Tia or Isabel, if you want to comment on anything or any questions. Okay. I don't see any on the chat, right, Tia?
Yes, there are no questions in the chat.
I hope it was clear enough. And also if was clear the complementary of both solutions. So normally we would review the general overview of a diagnosis in ExpertPath. And then when we reach the point of selecting which test could be confirmed this, then ImmunoQuery can be quite helpful to help us select the best markers and avoid unnecessary use of that of different markers that can be not so helpful, right?
Okay, for now I'm going to stop recording.
Okay.